Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe, and today my special guest is Dr. Lisa Difrancesco. Dr. Difrancesco has been in practice for 15 years. She's a plastic surgeon here in the Atlanta area, and she's been voted top doctor in Atlanta by her peers. She is double board certified in plastic surgery and surgery. She is fellowship trained in oculoplastic surgery or eyelid surgery, and she's been voted 3 years in a row best in Atlanta by her patients for breast augmentation and fillers and injectables. So I'm very happy to welcome Dr. Lisa Difrancesco to the show.
Neil, thank you, and I appreciate you having me on your show.
Well, let's get right into it. Tell us a little bit about DiFrancesco Plastic Surgery and how you're helping your patients.
Sure. DiFrancesco Plastic Surgery is conveniently located in the Buckhead area in Atlanta, Georgia. We focus on both surgical and non-surgical cosmetic plastic surgery options for patients for rejuvenation, to feel better, to look younger, and to look natural.
So you do a lot of different kinds of surgeries. What would you say might be one of the ones that you specialize in?
So one of the surgeries that we really specialize in is breast augmentation. We see patients at a variety of points in their life, whether they want to be larger in breast size, or they may have had children, or they may have undergone significant weight loss, and they want a better breast shape. They're all candidates for breast augmentation. They want their clothes to fit better, and they want to feel better about themselves. I have acted as a consultant to the breast implant manufacturers to help develop implants that are tailored toward what women want and what will serve women the best.
Well, we're going to get to that in a minute and talk about some of the innovations within the industry. But let's talk a little bit more about the problems that some women face and go into a little bit more detail. What kind of problems do they come to you with, and how do you help alleviate those problems for them?
Well, so in general, women in 2018 will come in and they often want a maintenance approach to rejuvenation, which means they want to start at a younger age. They want to start with non-surgical modalities, injectables like Botox, or fillers such as Juvederm, which patients commonly see advertised out in the community and in magazines. And they start with an approach early on to help prevent aging, to help look refreshed and less tired. They will often move on to more invasive technologies such as microneedling or even some of the ablative lasers as they get older, and then eventually they'll move on to surgery.
So it's really people are coming earlier and earlier. Is that what you're saying, to try and do the maintenance so that they aren't looking older as quickly? What kind of procedures do you do at that first stage?
That's correct, Neil. Patients are coming at an earlier age so that they don't have to have surgery until much later in life, because we have so many wonderful non-surgical options out there. Some of the just very popular top two would be Botox, and Botox is for fine lines and wrinkles, particularly the 11 lines or the lines on our forehead, or the lines, we call them crow's feet, around our eyes. Botox will work very nicely for that. As we get older, we lose volume in our face. Gravity will pull everything south, and our bony cheek structure, the bone will become reabsorbed. And so women will look to add volume to their face to fix those what we call nasolabial folds or deep folds around their mouth, any lines or wrinkles around their mouth. Their lip volume isn't as plump as it was when they were younger. And fillers can correct all of these areas very nicely. So those are our top two non-surgical options available to patients.
Mm. So what age are we talking about? Do people come in to see you? And I've seen some as young as 18 and 19 getting Botox, and that just doesn't seem natural to me.
No, typically Botox, women will usually start in their 30s for the Botox and fillers. 18 seems a little bit young.
Definitely. Now, as far as the face, obviously, we can tell that the face ages rather quickly, and men and women might have different views on that. Do you see a lot of men in your practice as well as women?
We see a fair number of men, yes. They're less likely to be Botox candidates. Men feel that the lines on their face make them look distinguished.
Yes. So let's move on a little bit. So we've got the Botox and the fillers might be some of the first procedures that people come in for. And what do they move on to after that?
So a lot of times patients then begin to look at some of our non-surgical body procedures, something like Sculpsure, which is an external applicator, an applicator that sits on your skin and it melts away fat. So as we get older and we have areas of fat, saddlebags, love handles, a little pooch in our stomach that we don't like, that are very difficult to remove, even with diet and exercise, patients begin to look for non-surgical options available first. And Sculpsure is an external laser applicator. You get 25% reduction in fat. It only takes 25 minutes, and patients see results in as early as 4 to 6 weeks. It's really the newest, the latest technology, and the best technology out there for non-invasive fat removal. Other non-surgical options available to patients that are very good with the body, radiofrequency tightening for loose skin around the knees, loose skin in the stomach, the neck, thighs. It's a small probe that goes underneath the skin, and patients see within 2 weeks skin tightening, collagen production, and those trouble areas that they just couldn't get tight on their own are now beginning to tighten up. And those results can last as much as 3 to 5 years for the skin tightening. And that's really the best technology and the most revolutionary technology that we've seen come out in the last 10 to 20 years to really help us with skin tightening, particularly in the body.
Yeah.
Those really are two fantastic non-surgical techniques that have come out most recently and have completely changed body contouring in the non-surgical arena.
That's definitely two procedures that I think a lot of people will definitely need. Let's go into a little bit more depth with both of those. Tell me about the Sculpsure to take 25% of the fat from your body in a specific area in a short amount of time like that is pretty impressive. Let's talk about how that works.
It's really been revolutionary, Neil, because up to this point, we haven't had any good technology except for invasive liposuction, which there's downtime, bruising, and swelling associated with that. The Sculpsure is the best new technology that we've had come out. There are 4 applicators, and the applicators sit on the outside of your skin. And you can put the 4 applicators across the stomach, or you could put 2 on one side of your love handles, 2 on the other side of your love handles. The applicator has a laser which will penetrate the skin and break apart the fat cell. The treatment only takes 25 minutes. There's no downtime, very minimal discomfort with it. No one ever has to know you had the procedure. There might be a little bit of redness, but there's no swelling afterwards. You can get up and go right to the gym. And then over the next 4 to 6 weeks, your body will absorb those fat cells and naturally excrete them. So if you don't want your spouse or your partner to know that you're having a procedure done, Sculpsure is the way to go. No one ever has to know you've had it done. You can go to the gym right after, and no one will know you had it done. So that's been completely revolutionary for us in this arena.
Well, I'm sure there's going to be a lot of people that are going to be after that, to do it privately without people knowing that they've gone to a plastic surgeon. I'm sure is a goal for many people. But tell me the difference between something, I know there's like body wraps, like It Works out there that is supposed to do something similar and melt the fat away. What's the difference between a product like that and Sculpsure?
So Sculpsure is FDA approved to melt the fat. So it's been tested very rigorously according to the standards of the FDA, and there are proven results. Body wrap, there is no scientific testing associated with that. There's no proven results that you're actually going to achieve any fat melting or reduction at all, and certainly nothing that's long lasting.
Mm-hmm. Well,
so one is tried and true.
Okay, so there's a huge problem in the United States in that there's so many people that are overweight and obese, and for those people that, change their lives, they go to the gym and they've worked out and they changed their diet and they've lost weight. I'm sure this radiofrequency tightening of the skin is really going to help them, because that is a big issue for people that lose a lot of weight is, what's going to happen to the skin. Tell me a little bit about how that works.
Sure. So radiofrequency skin tightening is for areas that you have a little bit of loose skin. For our massive weight loss patients, it just really depends on how loose the skin is. But the radiofrequency tightening is a small probe that goes underneath the skin, and it stimulates your own cells to produce collagen and to tighten the skin up. You see results in as little as 2 to 3 weeks. The procedure is done in office under a local anesthetic, and there's no downtime. People resume normal activities immediately after the procedure. They can go back to the gym in a day or two. There's very mild swelling and almost no bruising at all.
Well, again, that's something that is obviously going to be in high demand, as I think a lot of people will suffer from these two things. So that's two remarkable pieces of innovation that have come out that, as you say, have really helped in the contouring industry. So tell me a little bit more about what the next stage is from that. We've got the Sculpsure and radiofrequency tightening. Once people start to get some results there, what are they looking for next?
So there then comes the next tier of patients, which is often our surgical patient. And of course, our top surgical procedures are going to be liposuction, mommy makeovers, tummy tuck, breast augmentation, and eyelid surgery. They're probably our top 5 procedures that patients want.
So there's a massive difference, obviously, between mommy makeover, which is very invasive, and eyelid surgery. Why is eyelid surgery up there with the top procedures that people want?
Sure. So eyelid surgery, your eyes, everyone looks at your eyes. You cannot hide them. And your eyes often make you look tired. There are bags under your eyes, loose skin. The loose skin can often hang on your eyelashes. And therefore, it makes it a very popular procedure, not only with females, but with males as well. People want to look refreshed. So it's not necessarily that they want to look younger, but they want to look refreshed.
Mm-hmm. All right, so let's talk about the bigger procedures here, the mommy makeovers and the breast augmentation. What kind of person is coming in for a surgery such as this?
Sure. So for a mommy makeovers, it's a female that is done having children. They may have had 2 or 3 children, and they want improvements. They want improvements in their breast contour, and then they also want improvements in the contour of their stomach area.
And what kind of problems might they be having that causes them to take that kind of action?
Sure. So a lot of times their clothes do not fit right. They're buying an extra size, maybe because the breasts are saggy, or they may have a lot of loose skin around their midsection, or they don't look very good in clothes, and they want to begin to feel better about themselves now, particularly now that they're done having children. So tummy tuck and breast augmentation, with or without a breast lift, is sort of the natural route to go after your childbearing years.
So what do you think are some of the biggest myths or misconceptions out there when it comes to some of these anti-aging procedures?
Sure. I think patients look at other patients that have had too much plastic surgery, or maybe have had too many procedures. They may look overdone. They may look fake. And they don't look natural anymore. And I think that's probably the biggest factor that scares patients away from plastic surgery. Second, the idea of having surgery itself, the fear of going under general anesthesia, having to take downtime, having people know that you've had a procedure done, and there may be some stigma associated with that. But the good news is, Neil, that with our minimally invasive and our non-surgical procedures that we have today, we've been able to offer patients something different who don't want to have a surgical procedure for one reason or the next.
Yeah, there certainly seems to be a lot of new non-invasive procedures that are available to people now that weren't available in years past. Now, you mentioned at the beginning of our interview that you are on the board to look at some of these procedures regarding the breast, I think. What has changed, and what are you trying to get changed within that industry?
Sure. So I've consulted with some of the breast implant companies, and they've asked us to give input as to what women want with breast implants. And many women want to look natural. They don't want to look like they've had an augmentation. They want a better shape to their breast. And the breast implant companies have developed a shaped breast implant that mirrors the natural shape of the woman's breast. And that's been very popular, particularly with our mommy makeover patients that are a little bit older and they just want to improve the way their breast looks after childbirth.
So, from some of the surgeries that were, 10, 20 years ago, some of the products have changed as far as breast implants. Tell us a little bit about the fears for some of these older patients that have had surgeries many years ago. What should they be looking for? As I know there's problems with leaking sometimes. Is that a big problem? How do you address that?
So the implants, the breast implants today that we have on the market are much safer than the implants in the past. It's the most studied device by the FDA. So particularly with our shaped implant, they have the lowest complication rates of any of the implants previously. So that's really good news, Neil. And when we talk about You mentioned leaking, and so rupture would be one of the potential implant problems. Also, scar tissue forming around the implant. So with the different devices that they have today, they've been able to lower those risks to make a safer implant.
So tell me a little bit about the shaped implant. How long ago did that come out, and what kind of difference is that making in the industry as far as contouring is going?
Yeah, so the shaped implant's been out for about 4 years now, and the particular shaped implant that I use is a Mentor shaped implant, and it has some of the lowest complication profiles on the market. The implant itself is made right here in the United States of America, right in Irving, Texas. So it's a very, very safe device, and it gives women the safest device out there that will give them a little bit better shape to their breast, and a little bit more volume to their breast. It helps them fill a bra, and it helps them give a better contour when they're wearing a top or a tight-fitting tank top or dress.
Okay, so just basically it's looking better than some of the older products that are out there as far as that natural shape.
Absolutely. And we have more options available to us in terms of sizes, so we're better able to fit each patient individually with the implant that's going to work the very best for them and give them the best look that they want. Mm. So that's really, really been a huge revolutionary factor in breast augmentation. In 2002, I just had a patient in my office earlier today, and she had a saline implant put in. In 2002, that was the only option available to her. Now, today, she has 3 or 4 different options available to her with regard to implants. So that's been a huge help in getting implants that fit patients and they're able to deliver superior results and meet patients' expectations.
Well, it sounds like it's really customized right now rather than, before it was not necessarily one size fits all, but, one product fits, and that's it. Now you have a customized solution, which is great.
That's exactly right.
So tell me about some of the obstacles that people might be facing when it comes to getting a surgery such as that. Is there a cost issue or a time issue that comes up very often?
Sure. Neil, most patients have been on the internet and they come in very, very well educated. So they know what to expect with regard to costs and recovery time and so forth. I think the biggest objection for patients is being able to fit the recovery time in their busy schedule, whether it's a work schedule or they have children or very busy life. We live in a society where people are on the go constantly and can't take a lot of time off to recover from a surgery. And that is by far the biggest issue patients have is, when can I fit this into my busy schedule?
Mm. And what are some of the pitfalls that you see some patients make after they've had a major surgery, such as a mommy makeover or breast augmentation? What mistakes do you see them make as far as recovery?
Most patients want to get back to their normal life and normal activity as quickly as they can. And that's probably the most common is they start working out or they start doing too much too soon afterwards. And that's when you run into trouble. Our ability to control postoperative pain is really great. There are newer drugs out there that are non-narcotic, and so patients feel better after surgery. The anesthesia has improved significantly over the last 20 or 30 years, so they recover faster and they feel good, but your body still has to fully heal before you can resume normal activities.
Yeah, that's very, very important that they take care of themselves after surgery. Now, the reason I like talking to people like yourself, Dr. DiFrancesco, is that you really help people feel better and you make a difference in their lives. Give me an example, a story of one of your patients that have come in and, what issues were they having, maybe physically as well as mentally, and how were you able to help them?
Sure. I had a patient, young lady, not too long ago, very, very pretty, who had asymmetry in her breast. One breast was significantly different in size compared to the other breast. So much so she had trouble buying clothes, buying bras. Of course, in a swimsuit, she felt uncomfortable, and it really interfered with her confidence level. And we were able to do a breast augmentation on her, and even her size out and her shape out, so that she was able to go out in the world and feel much more confident and comfortable. She could wear a swimsuit comfortably now. She could wear tight clothing or non-loose fitting clothing, and feel comfortable with how she looked. And so that was really, really spectacular. Other patients that are very, very rewarding are breast reconstruction patients that have had breast cancer, or they may be young ladies that have a gene, the breast cancer gene, and they're going to have a prophylactic mastectomy. And everyone has heard of Angelina Jolie, and she had the breast cancer gene and had a prophylactic mastectomy. And those ladies are coming in and having breast reconstruction, often implant reconstruction, and it's life-changing for them.
Well, you definitely mentioned it with the first example that you gave there was the confidence, the confidence just to feel good about what you're doing really impacts the whole of your life and your production and everything that you do. So you're making a massive difference to people's lives, which is what I love. So tell me a little bit about yourself and how you got started, what attracted you to become a plastic surgeon.
Sure. So I'm originally from upstate New York, and really what attracted me to go into plastic surgery is there's a certain art to it. It's a combination of using either surgery or non-surgery, listening to a patient, understanding what expectations they have, what goals they may want, and then picking either surgical, non-surgical, whatever you have in your wheelhouse to help them achieve the goals that they want to achieve. It's not cookie cutter by any means. And so that was really the biggest thing is the artistic part of it and the ability to help people in their self-confidence, in particular other women. In terms of my background, I actually went to engineering school before I went to medical school. And then I went to medical school and trained in plastic surgery. I did a fellowship in oculoplastic surgery, or surgery of the eyelid and orbit. I did that down here in Atlanta, Georgia. And then I ended up settling down here in Atlanta, Georgia.
Yeah, we've got better weather down here.
Much better weather. Although this past winter it's been a little bit harsh, so
yeah, we're just not used to that cold. Can you share with us a lesson maybe that you learned early on in your practice that still impacts how you do business today?
Take the time and sit down and listen to what the patient's telling you. Listen to what they're going to tell you what they want, and just listen.
Well, that is definitely important to listen to the patient. They are your customer, and you do everything that you can to give them what they're looking for. Now, what's the most important thing that somebody who is looking for a plastic surgeon should evaluate before making a decision?
Sure. You want to look at experience. You want to look at the board certification. Are they board certified by the American Board of Plastic Surgery? Do they have hospital privileges? What hospital are they affiliated with? So that if something goes wrong, what happens? What is their experience with the specific technique that you're looking for? So those are all very important factors. Trust and experience, and you may talk to other patients or look at reviews and see what other patients have to say about their experience.
Well, it certainly seems like you have the trust and the experience noted by your peers as well as your patients. So tell us how people can find out more about Dr. Lisa Difrancesco and DiFrancesco Plastic Surgery.
Certainly. I would direct everyone to the website. It's drdifrancesco.com, and that's DRDIFRANCESCO.com. Or you can call us at 404-377-3474, and we'll be happy to answer your questions or book an appointment.
Well, excellent. I appreciate you being my guest on Business Authority Radio today. It's Dr. Lisa Difrancesco. Please, if you have any questions about plastic surgery, give her a call, visit her website, and I'm sure she is going to be available to answer all of those.
Thank you, Neil, for having me on.
I really appreciate it, and I enjoyed it. And to our listening audience, if you liked what you hear, hit that like button and share, and we'll see you next time on the show.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show or to listen to past episodes, visit businessauthorityradio.com.